His research interests focus on children with autistic spectrum disorders and diagnostic tools and co-occurring symptoms, which to me sounds very interesting, even though I know nothing about it, and I'm all happy to have some questions for him as we go along. I just want to point out, before we get going, because I always forget at the end and as people are getting up, our next Science Café will be on August 11th, and it'll be Dr. Libby Cowgill from the Department of Anthropology, and she'll be talking about Neanderthal biology, which will be just fascinating. I've actually judged many of her students' posters, and they're always just totally fascinating. So without further ado, Dr. Kanne.
Thanks.
Welcome.
Thank you. I don't think I've ever given a talk while I had a beer in my hand. This is like a first for me, which is awesome, I should say. All right, so I've been told that I should talk for like 10 minutes. Is that true? And then leave some time for questions and answers and discussion, right? So there's a couple of things just to kind of introduce the subject. One is most people who come to these kind of talk, they've somehow encountered autism in their lives, whether that be through their profession or through personal connections. And there's a couple of big changes that have occurred recently that might have prompted more interest. One, did you guys all see the numbers that came out a couple months ago with the increased prevalence of autism? Raise your hands if you saw those, like the CDC numbers. Right. So those are huge. So these numbers keep on getting bigger and bigger, like the prevalence of autism in the United States. So we can talk a little bit about that if you want. But that's tied very closely into a big change that occurred several months ago with regard to autism, and that's how we diagnose it. So just so you guys know, that in terms of the increasing prevalence, meaning there are more and more people across the country being diagnosed with autism, many people think it's an epidemic. Well, one of the big reasons why that's true is we keep on changing how we diagnose autism. So 40 or 50 years ago, how people thought of autism was just one little tiny piece of the spectrum that we now understand as a full spectrum disorder. So over the years, the changes in our diagnostic criteria and our understanding of autism and what it was has driven more and more people being identified, which is not a bad thing, that's a good thing. Because these folks who were missed before weren't getting the right services or weren't getting the right diagnoses. Well, that occurred again several months ago when the American Psychological and Psychiatric Association came up with our new statistical and diagnostic manual. So the whole diagnosis of autism has even further refined. So I thought I'd start tonight just by letting you guys know what is autism. There are tons and tons of myths out there about what is autism. So what I like to do at this point, before we go on with the other diagnosis piece, is have you guys ever met somebody who you walk away from and you're like, that was just weird? I mean, something felt odd or a little bit off about your interaction. I think we all have friends like that, don't we? Or at least I do. They tend to be more in academics, I think, than anything else, or engineer or IT people, right? But like you talk to them, it's like, it just didn't go well. Or you go on a date when you're younger and something happened that just didn't feel right. Well, that's what the diagnosis of autism keys in on. What are the elements of an appropriate social interchange that make it work and that make it appropriate? And people with autism, it's not just that they're not good at it, they often just can't do it. So it's a deficit, not just a delay. So the other piece, that's one whole part, is the social communication, how they socialize and how they communicate with others. But the other is how they get along in the environment. And this whole section is called restricted and repetitive behaviors. And there are several different types that you see. And in this category, you can have any one of these, or all of them. So kids who are younger or kids who have lower IQs, they often engage in what we call repetitive sensory motor movements. And if you ever think about autism, these are things that might come to mind, like the hand flapping that they do, finger wiggling, repetitive play with objects, those types of things. So they play and interact with their environment in an atypical fashion. So instead of playing with the truck, they're more involved in the wheels on the truck, for example. Another one is what's called circumscribed interest. So often kids who have either higher IQs or higher functioning, their world is consumed by a specific topic, and everything is about that topic. It could be like Star Wars. Now, all kids like Star Wars, right? But we're talking consumes their life. So be quiet, Nick. My son knows I like Star Wars, so hey. Probably a bad example, Pokemon. How about that? So it could be, but anything ranging from their bed sheets to books about it to whatever it might be. Everything, it just consumes their life entirely. And yet another dimension of this is unusual sensory responses. So we now know that kids with autism are much more, and we're all like this, right? We all have this differing response to the environment. Some people like heavy sheets at night, some people like light sheets. Some people, the tags bother them in the back of their neck. So some people like cold, some people hate cold. So we all have sensory responses. What we know in autism is that is even way further than normal or typical, that their response to sensory stimuli is extreme. And their aversion to certain sensory stimuli are extreme. So they might seek it out or they might avoid it, either one of those. So you have both of these components, they both have to be present. You both have to have this difficulty in your social communication, and you have to have this atypical or abnormal response to your environment. If both of those are present, then you may have autism. So, but when you describe these things, you wouldn't believe the number of parents that come to my clinic. My main job in the clinic, I'm the director of the Thompson Center, which specializes in autism. But my main role is a diagnostician. I diagnose tons of kids with autism or not autism. And just because you're a little atypical, just because you're a little odd, just because you're a little different, doesn't mean you have autism. That's not what autism means. I always give the analogy of anxiety. We all might experience anxiety in our lives. That doesn't mean you have an anxiety disorder. You have an anxiety disorder when your anxiety disables you in some way impairs your functioning to live your life the way it should be lived. And that's the same thing with autism. Just because you might be a little atypical or odd or eccentric or weird doesn't mean you have autism. You have to satisfy all the criteria, and it has to impair your functioning in the world. So there's been tons and tons of myths about autism, what causes it, how prevalent is it. I'll tell you right now, I would be happy if I lost the primary part of my job. And the primary part of my job is diagnosing kids with autism, and we do it behaviorally. If there was a blood test that could diagnose autism, I would love that. And that is one of the primary goals in our field right now, is to find some type of what they call biomarker to really tell if someone has autism. And there is a bunch of really cool research happening right now that is exploring that. Let me give you one example. There seems to be converging evidence that something goes astray in very early neural processing related to visual system. So if you're in the field, you may have read of visual tracking, even in 1 month olds is different. So they track stimuli even at the age of 1 month than other infants do. And it's a very basic neural system. So we're trying to find out what's going on there. Is that just autism? Is it a risk factor? And if so, if we can intervene then, if you can intervene the reason why we keep on trying to push the biomarker as low as we can is if you can identify when that derailment takes place, even if it's not autism, if you can intervene then, you can change the course of a child's life. So that's why there's this big push on the young kids and being able to identify as early as possible if they have autism or not. So the other big kind of area right now that we're exploring in our field is, I always like the analogy of cancer. So back in the 50s, for those of us who can remember back in the 50s, cancer was a behavioral end type. It was, and you even whispered it, I think they have cancer. All you knew is they had cancer, but you had no idea how they got it, what it came from, where it came from. And over the intervening years, what research showed was that there's 1,000 different types of cancer. And if we can identify the different kinds of cancer, we can actually focus on treatments that are specific to that type of cancer. Now, believe it or not, what we have learned, and this is, I will go on record as saying, autism is a biological disorder. It is a genetically based disorder. You are born with it. You are born with it in your DNA. You don't catch it when you're 3 or 4 or 5 years old. You are born with autism in your DNA. But given that, what we have to figure out, though, is right now, there's over 300 genes that we found associated with autism. We were hoping it'd be just 1 or 2 genes. It's not. It's over 300 genes. The study of autism has actually spurned and accelerated a whole new field, which is hot right now at Mizzou, which is epigenetics. So it might not just be the genes you have. It could be how those genes are turned on and off is what might be causing autism. So like I said, we've identified over 300 to 400 genes right now that are associated with autism. What that means is people might have different subtypes of autism, and that's what we're trying to figure out. Is if you have autism type B and you have a type C, maybe there's a different intervention that works better for you. There's even work being done on genetic interventions with Fragile X syndrome. They're actually finding certain gene therapy that reverses the symptoms of Fragile X, which leads to autism symptoms. So there's some really, really exciting work being done in the field of genetics, especially, trying to figure out how to address this disorder. Because right now, the only best evidence-based treatments we have for autism are behaviorally based, working with kids on a behavioral way to improve their symptoms. Am I past my 10 minutes? Is anyone in time maybe? Am I good? Yeah? All right, well, I could talk for 3 hours about autism because I love it so much. So is it okay to stop and take questions? Because I'm sure they'll lead all kinds of different ways. Do people have questions at all? Burning questions about autism? Yes, ma'am.
Well, when you speak of research, do they primarily, do the investigators usually concentrate on a particular age group when they're doing research?
So she said if you're looking at research, are investigators looking at specific age groups? Yes and no. So like at the Thompson Center, we have over 40 projects right now going on that range from DNA mouse models all the way to rat models, to monkey models, to visual virtual worlds that we produce and have people in those virtual worlds seeing how they react. We have new measures we're developing. What they found out, one of my colleagues in St. Louis, a neurologist, quipped, he's like, 4 out of 5 doctors agree that these kids grow up, which is true. And the problem is, so we're diagnosing all these kids when they're 3, 4, 5 years old. Well, guess what? They all grow up. So we have this tsunami of people that are going through the school systems and going through the educational systems beyond that have autism. And we don't know what to do with them. So all of probably the biggest improvements we made with respect to approaching autism therapeutically have been with young kids. And there's a good reason for that. I know people who have older kids get mad about this, or even adults, but the reason why there's so much focus on the young kids is their brains are still very plastic. And what we've shown is, again, to use an analogy, if you've ever known, I'm going to lie here, this is not true, but this is my wife, this part is true, that's my wife over there. Chris, say hi. So Chris, when she was younger, had a speech-language disorder. It's not true. But let's say she did. You would never know that by talking to her right now. Let's say her speech-language disorder is based on a 15q deletion or something genetically. But you would never know that now. The reason why is she's been through years of therapy to improve her speech-language disorder. So autism is kind of the same way, right? Even though it might be a genetic disorder that conveys a certain risk and a certain response to the environment, if you're able to do the right types of therapies to help them compensate, to help the brain develop in a certain way, you can improve their symptoms a vast degree. So that's why we focus on the young kids, because if you get them at the right point, you can actually change their entire life course. I always liken it to, as well, as you get a 3-year-old, let's say a 5-year-old who has autism, they've missed out on about 3 to 4 years of thousands of hours of practice getting along with other kids socially. So you need to back up and give them that as well to learn how to navigate those social worlds. So there has been a big focus on younger kids because of that thing. But there's a huge momentum now in the field of researching therapies and other types for kids going through transitions, whether it be in school, adolescence, or in college. Another little fact you guys should know, which is frightening to me. So I work with this guy who he was about 22, and he had just flunked out of college. So his parents brought him to me like, I don't get it. We did everything to help this boy. They set up an apartment in their basement and had him live independently in the basement. And then he went to college. When we tested him, he had over a 150 IQ, which is huge, by the way. He did all the math in his head. Brilliant guy. Flunked out of college in 2 months. When we found out why, number one, for 2 months, he never unpacked any of his boxes because no one showed him how to unpack his boxes. The second thing was they had a whirlpool at home to do his laundry, and at school, all they had was a GE. Now, think about that. You'd think that with a 150 IQ, you'd figure out how to use a GE versus a whirlpool, but no. And that's one of the most fascinating things to me about autism is it showed me the decoupling of how smart someone can be and how they can survive in the real world going through life. So what we found is we've been doing a disservice to kids as well, saying, if you have autism as a kid, you need to get in social therapy, you need to learn how to go. Well, no, actually, they might learn how to do chores, because that determines quality of life when they grow up, more than being able to read Shakespeare, or more than able even to have friends sometimes. So independent living skills have to be worked on separately from other types of interventions. So to answer your question a long way around, we focus a lot on the young kids, but there's a growing momentum to also work with older kids and adults. She has a microphone. One more try.
Try it now.
Epic failure. If you just tell me I'll repeat it for you.
I think mine is on.
They should both.
All right, I'll repeat your question. That's fine.
Okay, that's right. What you described with not being able to translate from GE to work or vice versa, right? Is a kind of analogical thinking. And I wondered whether that's characteristic, it shows up in other areas, or it's just peculiar to that individual.
That's a great question. All right, so the tough thing about, let me broaden your question a little bit, because the tough thing about autism, what makes our job so hard, is the core symptoms are the same. So you have to have the impairments in those areas I told you about. The problem is almost every person with autism has all what we call comorbid features. And what that means is almost everyone with autism has trouble with attention. Almost every person with autism has trouble with cognition. So, and it could be that, it could be a different cognitive problem they have, but it affects their intellectual capabilities somehow. Every person with autism, almost every person with autism has trouble with anxiety or mood disorders, GI symptoms, sensory issues, depression. The list goes on and on and on. And the problem when someone comes into your building and says, I have this list of symptoms, well, is that because you're anxious and shy and maybe you were adopted when you were younger and grew up in places with no kids, or do you have autism? So to broaden your question, there's a whole host of these comorbid symptoms that go along with the core ones that, I feel like I'm turning my back on you guys. Is that cool? All right, because otherwise you're going to move over here. that really deal with, you have to go through all those comorbid symptoms to get the core ones. But to be honest with you, when it comes to treatment, we don't treat core autism symptoms. We treat symptoms. We treat the anxiety. We treat the behavior problems, the aggression, the rigidity that they have, those types of issues. So they've done lots of studies to see if there's a common cognitive profile that people with autism have, and they can't seem to find one. What they do know is people with autism tend to have greater intertest variability, meaning they have what they call splinter skills. So they might be really good at this and really bad at this and really good at this and really bad at this. Where most of us in the room are, you have kind of a band of, yeah, I'm pretty good, not so good, pretty good, not so good. So their split of skills is much bigger. Which leads to one of the myths about autism, that every kid with autism is a genius in some area. It's totally not true. There's been some studies done that about 10% of the kids with autism show a splinter skill in some area. But even that isn't necessarily above the population. That's above their own skill level. I personally I've been doing this for a long time now, seen thousands of kids. I've only seen 2 people who have true prodigy skills in an area. So it's not as common as you would think. Like the Rain Man philosophy, you don't see that very often, to be honest, because it's impairing. I mean, the problem is it's very impairing. So let me expand on that a little bit. If you haven't heard, the main therapy that deals with autism in terms of best evidence is applied behavioral analysis, or ABA. The reason why you might have heard of it is it got passed in Missouri that insurance covers it. And that's huge for parents because it can cost upwards of $60,000 a year to do this therapy. So having insurance covered is a big deal. But let me give you an example. Can I use you as a guinea pig? All right, what's your name? You have to shout a little bit, so. Can we give him the mic?
Go, Matt.
All right, I'm going to just give you an example of what we do in our diagnosis. But not that I'm going to diagnose this man with autism. I've never met him before in my life, right? So I hope you don't have autism. But part of this is just being able to show you what we look for, what we do in normal social interactions. So I'm just going to have conversations with Matt, is it? I'm just going to so don't act different, don't act weird, just be Matt. Okay. Well, Matt, you might be weird, I have no idea. Just be yourself, right? All right, so where are you from?
Kansas City.
Kansas City, Missouri? And why are you in Columbia?
Going to graduate school.
In what?
Biophysics.
Wow. Do you like Kansas City better than Columbia, or do you like Columbia better than Kansas City?
I like Columbia better.
Why?
Just not as many people, traffic, a lot more opportunities.
Because I'm not from Columbia originally. I'm from St. Louis.
I'm sorry.
That's good. I have a brown dog.
That's great.
Now, did you all feel that right there? How weird that got because I just stood there and stared at him, right? Did you feel what's called a pregnant pause there? And that's sort of what we did. So if you were me, what you saw there was not only his normal reciprocal interchange, but I paused. I did what's called an offer of information. I said, "Oh, I'm from St. Louis." He responded immediately with humor, which is even better. But did you also notice how he cocked his head to the right-hand side? His rate of blinking became more. He nodded his head in response to everything I said. He leaned forward a little bit when he talked. Did you notice any of the nonverbals that went along with it? So part of a normal conversational interchange is like she's nodding her head right now. The social smile, if I smile, he smiles back. He can't stop himself. These are all the nonverbal things that happen in conversation, typically, that you don't even think about. And it has to do with this conversational game that you play, as well as all these nonverbals that go along with it. People with what makes that, when you walk away from someone with autism or your weird professor at college, it's because sometimes they don't do those things. They might just look down or talk in a monotone voice. Do you notice how his voice went up and down too, the prosody in his voice? One thing that we look at is how people use their voice. Some people with autism, they just sound a certain way. We call it the closed eye test. They don't use their voice the same way. They might sound like little professors, or they might lecture to you. Well, actually, Dr. Kanne, I think that you mean that. They sound like that. And they have a particular way of talking. So to get back to your question, the reason I showed you all that was you can work with someone with autism and improve those skills. There was actually Tim Page came to town. He's a Pulitzer Prize winning journalist who has autism. And this is what I do for a living, right? When I first met him, I had no clue. He had a conversation with me. He talked to me. He seemed a little flat, a little awkward, but no big deal. And then I realized he told me he had Asperger's syndrome, which we don't call it that anymore, just so you know. That diagnosis has gone away. He had Asperger's syndrome, and he told me about his past, where it was severe. But what he learned to do is to count how long he's making eye contact and then look away. He learned to modulate his voice. He learned to ask questions. So as an adult, he's learned to compensate in many ways for the interaction. Then what he told me is, after tonight, I have to go to my hotel room and be alone for 2 hours to recuperate from this, though, because it's so much cognitive energy to do that. So what you just did naturally, it would take him a ton of concentration, like he's taking a test, to be able to do. So my point is, the behavioral therapies that you do, that's what they do. They attack points of intervention, fulcrum points that teach people how to behave. Let me give you just one more example that's probably more relevant for young kids. Do you guys know, you ever watch a mother with her baby? And the motherese they talk about, oh, you're such a cute little, how they talk to kids. There's a reason why they do that with their vocal register, because it helps with sound discrimination. Do you ever notice, if you hold, keys up to them, you go, oh, look at the keys, oh, look at the keys. Do you know why that's so important for a child to do? Let me rephrase this. Let me show you a skill that I bet you all have. Let me ask you why this is such an important skill. If I did this, what does it give you the urge to do? Right? Right? You ever seen those thing where they're looking up at the sky and everyone stops and looks too? That's called joint attention. Think about it. If you weren't a social creature, why would you do that? I dare you to go try that on your cat. Go up to your cat and look like this, and the cat won't look. Well, the dog may, depending on the breed of dog. Some dogs are bred to pay more attention to those things. So where you direct your eyes is what we know is where you direct your attention. And as a species, we've learned that, if I'm doing this, because you've read my facial expression, you will have a better chance of surviving. If I'm seeing a lion running at us, I'm like, then you're going to see it too. So we have learned to evolve as a species to have that skill. So back to my other example with the keys. Why is joint attention so important in talking to babies? Does anyone know? It's the first step before language. So if I'm holding up a set of keys and going, oh, look at the keys, and notice I'm doing it with my eyes. Watch a parent with their kid. They'll be doing the same thing, looking back and forth. If that baby doesn't know that you're talking about those keys when you've just labeled it 100 times, the baby will never learn to call those keys. So joint attention is called a pivotal skill, which means that that's a skill that's pivotal for kids to have that is important to language development. And you can't have language if you don't have joint attention. It's really difficult. We know for a fact that people with autism, that's one of their main areas of difficulty is joint attention. They have trouble with it. So if I take a 2-year-old and I'm like, oh my gosh, look, that baby's not doing joint attention yet, and they should have by now, then that's when you intervene and teach them joint attention through behavioral techniques to be reinforced to look at eyes and follow the eyes. And suddenly you just jumpstart their language. So now instead of a 6-year-old with a language delay, you have a 2-year-old whose language is almost tracking typically. Then you can focus on these other skills, like facial expressions, like tone, these other things. So that's just another example of how the behavioral techniques can choose behaviors and make a real big difference in these kids' lives. Other questions?
Okay, so presumably we'll be encountering people from all across the spectrum. Are there any rules of thumb that we can, interaction type tools that we can use that would be a safe bet to make the interaction go smoother?
By the way, did you notice how much she used her right hand when she just said all that? Those are called emphatic gestures, and she also nodded her head, so good job there. You can't stop to see how she just smiled and thumbs up. That's an instrumental gesture that we code, actually. So I just diagnose everybody. That's what I do for a living. So great question. So what do you do when you encounter a person with autism? So the first thing you should know is that we call it, again, let me broaden your question a little bit. We call it the Walmart phenomena. And this is what is one of the saddest things I've heard it from so many parents. And it's usually in Walmart that it happens, which is why it's called Walmart phenomena. You have a parent who has a child with autism. They're walking through Walmart. That kid reacts to their environment in a way that kids with autism do. They might have a meltdown. They might have a sensory response. They might be rude to someone. Someone says hi to them. They might just growl at them. That has happened. Whatever the behavior might be, it happens. How many times have I heard parents say, you know what? 2 other people walked up to you and said, you just need to spank your kid better. You need to be a better parent. So this is the Walmart phenomena. So part of it is a sense of diversity, is don't assume when you encounter, even in a restaurant here, we have our social skills group where we take in Colombia a group of teenagers who have autism out. It is a blast. I mean, because they don't know how to get along in public very well. And they laugh at themselves at some of the things they do and say. It's hilarious. But you'll have people get mad. You'll have people get angry in the restaurant, like, can't you shut your kid up and can't you do this? So part of it is a little bit of patience, a little bit of respect, that just because a child's acting out doesn't mean the parent's doing something wrong. It could be that child has something going on. So don't jump to judgment, I guess is my first point. The second point is if you do recognize that something like autism is going on, don't be afraid. I remember when I was going through my training, I met my first person with schizophrenia, and I had seen so many movies of people with schizophrenia that were murderers that I was like terrified to meet this guy with schizophrenia. And he was the sweetest guy in the world, harmless, but I was terrified to meet him. And that's the problem too, is so many people have kind of an expectation about what autism is, either because they've seen movies or because they've had another experience with someone else with autism, that you presume that this person is going to be the exact same as that. And you shouldn't do that. So every person with autism, don't be afraid of them. They're a person like any other person. You should treat them just like every other person. That doesn't mean you walk up to the parents and go, oh, I'm so sorry you have a child with autism. Would you ever do that to my wife with our son there? No. You just treat them like any other person out there. But then there's the piece where if you see someone with autism starting to react a certain way, be aware of it. So the first thing is to back off. So we don't know why kids react sometimes to their environment. It could be the color red in the pizza. It could be a sound they just heard over there. So once they start doing it, you gotta give them a little bit of space to find out what's going on, to understand the behavior, and then have the parents react appropriately. So don't, again, jump in and try to help unless the parents ask you to do that. I hope that helps a little bit, yeah. So we have all kinds of other training for first responders, because that's a whole other issue. Do you guys know what the highest mortality rate is for kids with autism? Why they pass away the most? Drowning. So elopement, it's called, or wandering, is one of almost 40 to 50% of the kids with autism elope, which means they escape from the house. and for some reason they're drawn to water and they don't have a sense of safety. And they often either can or can't swim, they jump in and drown. So we do a lot of training, not only in Columbia, but across the state. And being able to talk to first responders. What do you do when you encounter a person with autism? The first thing you do is go to the bodies of water to see if they're there. The second thing is, let's say you have a gentleman or an adolescent who has autism, who is higher functioning. And you wouldn't know it by looking at them, by the way. You can't tell. So, but if they identify themselves or you suspect it, you do have to handle them a little bit differently with regard to approaching them. They might be more rude. They don't have the same social graces that we do. So if you talk to them, they might not respond. They might lower their head and turn away. They might run away. If you touch them, they might react in a big way. So we work a lot with first responders, and if you suspect someone has autism, what is the appropriate way to approach them in school? Or, I'm sorry, if they do something incorrect or for a law enforcement person. And then we talk to a lot of schools with regard to autism. It's so important for schools to recognize if a student has autism because their behaviors might be different. They can be very concrete, very literal, and again, they don't understand the social graces. I had a patient who slapped the behind of a woman student, a girl student. Zero tolerance these days. That kid got expelled. But we went back to the school and said, no, he has autism. There's a behavioral plan that says how he's supposed to interact with other kids in school, and it doesn't require him to be expelled. So depending on how you give instructions and how they react to those, you might have to react differently yourself. So. Other questions? Yeah.
A couple years ago, I read a book. I can't remember the name of it.
Do we think it works now? Let's try it. Yeah.
A couple years ago, I read a book. It was called, I think it was called Look Me in the Eye.
Yeah.
Okay, and he's about my age.
Yeah.
And so I was kind of wondering, we talk about it kind of currently, but obviously it's been going on for a long time. And he wasn't diagnosed until he was in his mid-40s or something. And his life was pretty rough. It was kind of comical, but it was a good book. But I'm kind of curious about what, we're very focused on what's happening now, but people that are my age, maybe even a little older, what happened? Because they were there, they were out there. I don't remember,
Sure.
He would have been in the same grade in school as me and everything. I don't remember anything like that. And so I'm just kind of curious about the history and how things have
Where were
developed.
they?
Yeah.
Oh, by the way, if you had to use a number, like how many people have autism in terms of prevalence, regardless of the CDC numbers, 1%. That's the easy. What we've done, not we. A gentleman in the field who's actually coming to Jeff City at our conference is the world's expert on prevalence in autism, Eric Fonbaum. He shows that over 30 years, the prevalence has remained the same, which is 1%. So that's the easiest number to go with. 1 in 100 people have autism, period. Across cultures, across races, across SES, across ethnic variety, 1% is what the studies pretty much show. So what she's referring to is an author by the name of John Robeson, whose brother wrote Running with Scissors. You ever hear that? It became a movie, a very famous movie, right, Chris? So even in that movie, he talks about his brother who was a little bit odd, which is John Robeson. So just so those of you who don't really care that much about that, you should know that John Robeson invented the pyrotechnics for the band AC/DC? No. Kiss. So he invented pyrotechnics for bands because of his engineering genius.
And his snake, when he killed the snake.
So he writes in a very funny way, which just, not that I'm dropping names, but I know John personally because he serves on national committees with me. And John is hilarious, and he's come to terms with his higher functioning autism. Just to tell you one quick story about that, about the schools. We're at this grant review where we decide what research needs to be funded in autism. And one of the proposals was for research in schools. How do we help kids in schools do better with their autism? And it was all like, okay, we need to get them a mentor, and if they say the wrong thing, we got to make sure they get this. And John, who has autism himself, and raises his hand, he's like, what are you talking about? He goes, in school, if someone says something to someone else like that, they should get punched in the face. This is his own advice. He's like, no, he goes, there's a thing called natural consequences. If people say things, they should have a consequence for it. We don't need to coddle these people, meaning people with Asperger's like himself. We need to train them out of it, but you don't need to be coddling them. So I thought that was kind of interesting that John would say that. Where were they? There's a couple of different theories about that. One is, if you think back, there might have been those geeky kind of kids who just were clueless and didn't get it, didn't have any friends, and whatever the thing was into then, now it's video games, right? But whatever it was then. So you might have just passed them off as the geeky science kids. Another is many of those people we know were misdiagnosed with mental retardation. So they might have been mainstreamed in a whole different segment of society, either educationally or even community-wise, institutionalized. So depending on the severity that they present it with and what road they went down, a lot of these kids can do okay in school. They don't do great, but they do okay, so they'll survive. So you might not have recognized, they might have been the quiet classmate that you never talked to. Teachers, or they might have been the behavior disordered kid, because they have so many problems with their behaviors that they become the kid that gets in trouble all the time and ends up going down that path. So most of the reasoning is that these people were there, they were just misdiagnosed or missed completely.
You told us at the beginning that it is a genetic disease, okay? Does that mean there's no environmental influence? I mean, I know the whole virus thing is debunked.
I'm so glad you asked that.
But, there's all these correlational studies with, age of father and type things. So what's going on there?
Absolutely. It is not vaccines. It's not vaccines. And I think that's what you meant by that. But by the way, even as a clinician, you don't know how compelling it is when a parent comes in and says, my kid was fine, they got their vaccine, 2 days later they had autism. And it's compelling. And not that you don't believe the parents, but what we always say is it's not the vaccine that might have caused it, but it might have been whatever pushed them over the edge. So the genetics might have given them a genetic predisposition for autism that somehow got pushed by an environmental factor. It's interesting because one fact that you might not know is autism is considered the most heritable psychiatric disorder, period. In terms of the penetration and the inheritance rates, the most heritable. It's true, right? Like, how many times have I sat there and let's say I have a family and the mom's like, I've known since day one there's something wrong with my child, I've known it. And the dad's like, there's nothing wrong with my child, he's just like me, right? And then I come back 2 hours later and say, guess what, Joey has autism. Well, what did I just do? I just diagnosed the dad too. So what we know now is about 30% of the cases, we actually can identify the genetic disorder that's its foundation. That means 70% of the time it's idiopathic. We still don't know. Our assumption, and there does seem to be a difference for those of you who are more into genetics. There are what we call the de novo mutations, which we know occur and represent a certain population of kids with autism that are just brand new mutations. But then the whole other part of it is a strongly heritable disorder that if you have a parent with autism, the chance of having a child with autism is raised greatly. A lot of the studies thought it was really high, like 80, 90%. All the new studies, though, with the broad rates are showing that it's more like every other study, 50-50, 50% genes, 50% environment. But what do we mean by environment? What we mean there is it could be intrauterine environment. It could be stress by the maternal stress can cause changes in the fetus. We know that it could be immunological. So there are many immunological disorders that we know seem to be attached to autism. So they might take some immunological hit involved there. It could also be epigenetic. So whatever environmental changes happen that cause different genes turning on and off can also cause the turning off of the genes that are more susceptible to lead to autism. The one, I think, common denominator that we're seeing is it seems to be a disorder of connectivity. So whether it be synaptic transmission, there seems to be a lot going on there, or the whole neural pruning versus not, there seems to be some common underlying themes that almost every gene leads down that road eventually, or the main candidates do.
So from the perspective of somebody who's interested in vocabulary, you said the word epigenetics a couple of times today. Could you define that for us? Especially in the context of the fact that the articles just came out indicating epigenetic effects of C-sections and things like that.
Do we have a geneticist in the room though? Because I'd hate to embarrass myself. All right, I'll have to admit, when I'm in a room full of geneticists and they start talking, literally 3 minutes, I have no clue what they're talking about. It's one of those fields that they have their own vernacular and they lose me quite quickly. So let me give you my layman's understanding of epigenetics, which I'm sure a geneticist might take issue with. My understanding came from an article that I read that was the beginning of epigenetics, where they had this village, right? And it was an isolated village, and this village had offspring, and they had a certain rate of how long people would live. so life expectancy. And then what they found is there was a drought. And what happened was their progeny had a longer life expectancy. And then what they found is after they had a bolus of food, not those people, but the people who came after them, their offspring had shorter life expectancies. So the life expectancy in the progeny was determined by how much you ate. So that's to me like the simplest explanation of epigenetics. Something in the environment occurred which changed your genes that you pass along to your offspring that then can change many different things like life expectancy even. So the notion is there's something you have the same genes as your parents do and they do and et cetera, but there's something in the environment that either activates a gene or deactivates a gene, and that causes all these changes that we see. So that's my really low understanding of epigenetics. And it's important in autism because we can't find a single gene. So what they're thinking is there might be these other environmental factors that turn on and off the genes in a certain way.